fact that you would choose to be here in Oakland Junior High today is really remarkable. Thank you for coming. I know you struggled with parking, and so thank you. I'm assured that no tow truck is going to move those cars out there on 15 on Manning, so we are very grateful to have all of you here today, so thank you very much. You could also be at the State Fair right now ordering a Pronto Pup, and probably some of you are planning to go there. My husband says, hey, it's the cleanest day of the fair, we've got to get out there. So you might see us out there. I don't know if our kids made it to the forum. They're probably at the fair right now. So thanks so much. We've had a great summer. I mean, we were able to bring Brett Favre in to wear his number 4 jersey here for the Vikings. That's a great summer down payment. Uh-oh, maybe I opened up a can of worms. But we got Brett Favre here, and we had the PGA here, which was extremely exciting. We had Tiger Woods, and there was a rumor that this weekend... Well, we're going to talk about healthcare. But there was a rumor that President Obama was going to have Tiger Woods play a round of golf with him on Martha's Vineyard this week when he was on vacation, and I don't think there's any truth to that rumor, but we had also heard that the President may try and hit him up for a $300 trillion loan, which maybe we could use about now here in our economy. So anyway, we're very grateful that all of you are here, so thank you for that. As we're looking at the context of the debate today, one thing that we're looking at is the fact that, and hopefully we can work that out, we do want to have reform in healthcare. There's total unanimity. There is total agreement. I don't know anyone, and Dr. Burgess, who's joining me here on the dais today, I don't know anyone in Congress who wants the status quo. We want reform, and we want to change the way that Washington does business on healthcare, and I think we're going to get it. Because all of you are asking for a new way to do it, but the question is, what kind of reform will it be, and will it be one that we can live with in the long term? We have to have it. But the question is, will we go down a road where all of you have more control over your health care, more decision-making authority, where we can actually reduce costs, or will we take a road where government has more authority over our health care, and government has the say over our health care decisions, and one where we lose the authority over costs, but government picks up that authority? That's really the crux of where this debate begins. And that's why we're so anxious to hear your opinions. Again, pro or con, we want to be able to be here to hear your opinions. And a robust debate has been taking place across the country. And thank goodness the 6th District is no different. You want to be heard as well. So before we discuss the different paths that are available to us, I just want to lay a little bit of context about where we are right now financially in the country. Because healthcare is smack in the middle of our financial system that we're currently dealing with. And the President has said quite clearly, and I believe him at his word, that he wants to have health care reform because he wants to control costs. And again, I think that is unanimous agreement. We want to control costs. There's a difference in how we approach it, and a difference about what we believe will control costs and what will control costs. But we are at a truly perilous time economically in America. The policy chair of the National Center for Policy Analysis is a gentleman named Mike Whalen. And Mike Whalen wrote that the United States is functionally bankrupt. And he says that we are, even before we consider this multi-trillion-dollar health care bill that is currently before the House. It's known as H.R. 3200. Tuesday, you probably saw in the news that the White House released the updated budget numbers, and they read kind of like a Stephen King novel. They're very scary, the budget numbers, because the administration is projecting a deficit this year of $1.6 trillion. That's a lot of money, that level of deficit. Just earlier this year, the White House predicted we would be $7 trillion in debt in the next 10 years. Well, just consider, between the first part of the year and today, now the Congressional Budget Office is estimating a $9 trillion deficit, potentially 10. That's a tremendous increase in debt level. And we have, I believe, this out, if you picked up some of the literature that we have on the tables, Sometimes we can get confused when we hear the terms millions, billions, trillions. What does that mean? Well, let's just take an example. 1 million seconds is 11 and a half days. 1 billion seconds is 32 years. 1 trillion seconds is 32,000 years. There's a big difference between billions and trillions. And when our country continues to spend money with no thought as to how we're going to pay for it, it's the 19 and 20-year-olds in our society that are going to be saddled with that debt, the borrowing costs, the spending costs, the taxing costs. We have to consider that generation. And if you took a tightly stacked $100 bill packs, that if they totaled $1 million, it would be about 4 feet high. But if you had $1 billion, that would be 4,000 feet high, or equivalent to 3 Sears towers stacked on top of each other. That means if you had $100 bills that total $1 trillion, it would be 789 miles high, or 144 Mount Everest stacked on top of one another. So these numbers add up. That's the point. They add up and they mean something. And so as we look at the context of healthcare, we have to consider the cost. Because we also have another document out there that I want you to take a look at. Government has always grossly underestimated the cost of the programs that it puts into place. And this is healthcare costs. Historical understatements highlight the unreliability of projected costs. Medicare was passed in 1965, and Congress estimated that Medicare would cost $9 billion in 1990. It actually cost $65 billion. And with all of the changes in Medicare, the ratios of government underestimating the costs are about 7 to 1. So we have a historical analysis where government has they've never overestimated the cost, they've always grossly underestimated the cost. There was a study that was done in the late 1980s, and it showed, for instance, with Social Security, the kids that were born in 1987, who are today about 22 years old, those kids, when they get into their prime earning years, could be looking at about 25% of their paycheck going to pay just for Social Security. Medicare costs a lot more than Social Security, so that would be at least 50% of their paycheck. That doesn't include federal income tax. If you include federal income tax of about 30%, now that 22-year-old is up to 80% tax rate. Then you have to include your state taxes. In Minnesota, maybe that's 8%. That'd be 88%. That doesn't include property taxes, sales taxes, gas taxes. We cannot do that to the generation that's coming up, to spend money without thinking about how it's going to be paid for. So I lay that context down as we talk about the future of healthcare, what we're going to have and what we're going to pay for it. One option is to have the government take it over and pay for healthcare and create a new program. Here's another option that hasn't been talked about very much. And that's the option where you own your health care, not government, not that I think that we should put into the debate mix to talk about. Because this is something that won't add to the government debt substantially the way that the option does on HR 3200 in the House. If people can own their own health care, here's a couple of things we can do. And we can go forward again and talk about this further because, again, we want to get to your questions. We can do this. There's a law right now at the federal level that says that states can, in effect, draw boundaries around their state, and insurance companies don't have to compete with other companies outside of their state. This jacks the cost of health care way higher than what it would need to be. If we took a big eraser and erased those lines at each state boundary and allowed people to buy health care anywhere in the United States, in other words, if we allowed more competition among insurance companies rather than less